Hey, it's Sarah. I'm back, and oh, look at my grout. I'm gonna be blonde the next time you see me. I'm so excited. Okay, it's Sarah. I'm back. We're gonna talk autoimmune hepatitis because I had my first appointment with my hepatologist, Dr. K. So in case you don't want to watch the whole video, long story short, yes, I have autoimmune hepatitis, and yes, we're gonna start treating it with immunosuppressants. So as I shared in my last video, my gastroenterologist, Dr. B, had decided to refer me out to liver specialists. And the one that I was able to get into was his first choice, called Liver Institute Northwest. And this practice was interesting to me because they do research and clinical. Research, you know what that is, and clinical, seeing patients. They also do a lot of clinical trials. So I, as a nerd, was really excited about that. So did all my paperwork and showed up today for my first appointment with Dr. K. This office, I've never been to a doctor's office where everyone was so nice and kind. And it had a very different feel and a very different culture. And I'm going to put that aside on my org development nerd place for another day. But it made something that was going to be really kind of nerve-wracking for me a lot better. So the appointment was really to confirm the diagnosis. The first thing that they did was something called a FibroScan. And it's similar to an ultrasound. It's an imaging technology, but unlike an ultrasound, which is just kind of continuous, the FibroScan just takes pictures. And the tool, like an ultrasound, it's got a little wand that they use, and they use the gel. But it actually has a physical pulse in the wand. So it feels like someone's tapping on your abdomen. And it was really weird because, as I shared before, as I now know, the liver's way up here. Evidently though, I don't know if he was a resident or an intern, a medical intern that was doing the test, had said that livers move in the body. Things you never knew. So the point of the FibroScan is to just look for fibrosis, cirrhosis, so hardening of the tissue, the density of the tissue in the liver. The challenge with the liver biopsy, as I'm learning, is that you're only biopsying one site within the liver. So while it can give you some information, fibrosis isn't necessarily evenly distributed in the liver. So trying to understand more on how you monitor and diagnose AIH, it's really a combination of the blood tests, so looking at the liver enzymes, as well as a liver biopsy, FibroScan, and you could have other symptoms. Fatigue is really the only one that I have. So did that, did all the vital stuff, and then got to meet Dr. K. What a cool doctor, very nerdy. He gave me an A in patienting, which I was really excited about because he said I asked good questions. He had the notebook. I noticed the notebook, and just trying to clarify a bunch of things where my general practitioner or my gastroenterologist were unwilling to answer some of these things. So long story short, yes, he is relatively sure of this diagnosis. I'm the right age. I'm a female. Sorry, right age for diagnosis. I'm within the normal age. I'm a female, and I have another autoimmune disease, microscopic colitis. So it's pretty straightforward. From the FibroScan, they think I'm in stage 2 of AIH. So the stages go 0, which is basically completely healthy, no fibrosis, no problems, to 4 is cirrhosis. So I'm at 2, right in the middle. That's mild scarring. That did not show up on the biopsy, which is interesting. But again, that's why it sounds like you use multiple diagnostic tools for AIH, because otherwise you could miss it. A liver biopsy could come back. Mine didn't show fibrosis in the samples that they took, but the liver's a pretty big organ, So the goal is for them to get me into complete remission, and he said he's had even people in stage 4 cirrhosis be able to go into remission, and that's because the liver is constantly regenerating itself, which is pretty normal. I sort of had a hope that maybe it wasn't that bad because I got a blood draw last week and the liver enzymes were down. The AST, the ALT, you know them now, just like I do. And he said that's a huge mistake that a lot of people make when diagnosing AIH, because they'll wave, right? They'll come up and down. So even if you catch a trough, that doesn't mean it. So if I'm looking at this, it looks like a 3 to 4 month cycle. I can start to see the pattern when he said that. So that was interesting. The main reason I came to him, as I shared before, is that steroids are the first line treatment for this, with an anti-proliferol. I have to look at my notes because he started just throwing out terms, and I have more reading to do. Steroids could work. We still could go back to them. I actually showed him a picture of myself last summer when my husband and I went to Chicago for a few days. And just to show him, like, this is what steroids did to my body. And he was really compassionate. Dr. K said, yeah, I can tell it was a huge impact on you. He's had other patients who haven't been able to tolerate steroids. So we are going to go immunosuppressants only, which was what I was hoping. And I was a little concerned because before I saw Dr. K, he has a doctor there working on his fellowship. So for specialties and subspecialties, after a physician goes to medical school and becomes a doctor, they go into a fellowship. So he is a doctor, he's a practicing doctor, but he's spending 1 to 3 extra years becoming an expert in the liver. And he had said, well, this might be difficult because steroids are the first line treatment. And my heart just sank because I thought that's why I was here. It was because this doctor treated things differently. And then when Dr. K had said in 30 years of practice, he's only seen like 10 to 12 people who have this reaction to this steroid, I realized, oh, this is really rare. And we talked about this. My body doesn't seem to metabolize medication the same. So I am going to be going on Azathioprine, Aza for short. He kept calling it Aza. And this is a immunosuppressant originally designed for people with kidney transplants to make sure that their bodies didn't reject the organs. It's been in use for multiple decades, so they have longitudinal studies, and so they have a good sense of what it does to the body, and you can be on this medication for life. I think I shared before, 80% of people on immunosuppressants will stay on them forever. So I understand what this means. I really appreciated how he walked through the risks. The biggest risk is changes in your bone marrow composition and liver toxicity, ironically, but it was originally designed for the kidneys. And then the other thing, I'm just looking at my notes because this is just today, was that you have an increased risk for skin cancer, so you're going to burn more easily. And he said, just based on your DNA, I need to talk about that. And then it also doubles your risk of blood-based cancers, so lymphoma and leukemia. He said he's never had a patient who's had that using these medications in 30 years. Their risk is already quite low for those types of cancers, but that's what it is. So I appreciate it when you hear, yeah, there's pros and cons of all of these, and there's side effects like nausea, upset stomach, other things. Don't really care at this point. I'm willing to try anything, and I already went through some weird medication for the colitis. So I'm going to be starting on a pretty high dose. It would be a lower dose if it was paired with the steroids, but since I'm not taking the steroids, it's going to be a pretty high dose. So we're going to see how that's going to go. And then they'll do a couple things to monitor. One is these regular blood tests, and that's to check these different markers for my bone marrow and my liver toxicity. So that's going to be an ongoing thing monthly for a while, is getting some blood draws. And then today they did a blood draw. By the way, this was the best blood draw I've ever had, this phlebotomist. I feel like I should hand out awards to these folks because they're amazing. She did a great job. Today they also took a blood draw because they're going to check both functionally and genetically how fast I process medication. Isn't that cool? If I process faster or slower, or metabolize faster or slower, then they'll adjust the dose. So yeah, it was a pretty big day. I am really thankful. Liver Institute Northwest was amazing. Amazing. I felt so welcome. The office was so nice. Everyone was so positive, so caring, really thoughtful. I just had a different feeling than a lot of places, and I don't know if it's that there are a lot of medical students and fellows that work there, or if it's because just the office culture that they set. The liver, yeah, it's kind of a niche thing, it sounds like. But I'm happy to know that the diagnosis has been confirmed, that I have a treatment plan, that it might not be easy, but at least I know what's going to happen. I need to understand a little bit more about what this means for my immune system. So I did get my second booster a week and a half ago. I got a week and a half ago. A week and a half ago, knowing that I might start on the immunosuppressants, so wanted to get that ahead of time. I got my first Pfizer. Fine, felt fine, feel great. So just wanted to be following a physician's instructions, partially immunocompromised in the last year, and now will be immunocompromised. I don't understand yet what this means for me in interacting with people, especially in this pandemic, endemic, whatever we're in right now. I do think I'm going to have to be careful, a little more careful in the near future. I still have not gotten it, the Rona. Still have not gotten it in, what is this, 2 years, 4 months? Who knows why? I am antisocial. I'm going to point that out. And I was working from home. To my knowledge, have not gotten it. Would prefer not to get it. And realizing I could be coming into a higher risk period just because of the medication that I'm going to be taking. And just might have to be more careful in distancing or masking, or especially with people who have made different choices about the pandemic than I have made. So yeah, that's just what it's going to be. I need to understand it a little bit more, protect myself. It sounds like it's going to take a few months for the ASA to really kick in. So we'll see what happens. I don't know that I could feel any better at this point. I mean, I'm very tired, but the tired part. Don't think I could have gotten any better. I'm really, really thankful. And now I can give all the other physicians the updates and just start figuring out what it's going to be for my care plan. So yeah, AIH, here we go. Thanks y'all for listening.